Should I be screened for prostate cancer?
Well, that's a really good question, but it's not one that's that easy to answer. There are many different guidelines out there for screening for prostate cancer, and all of them basically agree that the decision should be made between the doctor and the patient. Let me tell you first a little bit about the prostate. The prostate is a gland that sits below the bladder and above the rectum and functions by providing fluid for sperm for transport during ejaculation. Prostate cancer is currently the leading cause of cancer diagnoses among men in the United States and the second leading cause of cancer death among men in the United States. So, what are the controversies about screening? Prostate cancer can often be a very slow-growing disease, and many men will die from diseases other than prostate cancer before they even become symptomatic with prostate cancer. Currently, the recommendations for prostate cancer screening would be that every man between the age of 50 and 69 be screened annually or every 2 years with a prostate-specific antigen blood test, better known as a PSA. In those that are high risk, which include black men or men with a family history of prostate cancer, screening can begin earlier at the age of 40 to 45. So, what's the controversies? In favor of screening, there was a large study that was done in Europe that showed that cancer deaths from prostate cancer were reduced by 20% in men who were screened for 13 years. Aggressive disease was also found at a much earlier stage, and treatment of aggressive prostate cancer is much more successful when it is found earlier. Some of the reasons against screening for prostate cancer are that in that same study, 1,000 men had to be screened in order to prevent just one prostate death. Also, 75% of those who had elevated PSAs were found not to have prostate cancer and underwent testing that has potential side effects. With the fact that prostate cancer can be so slow growing, many men may be treated for prostate cancer who would end up dying from something else other than prostate cancer. So basically, the personal values and preferences of the man being screened are going to be the leading reason for determining whether or not a person should be screened for prostate cancer or not.